Hello, I'm Dr. Jon Perlman, Beverly Hills plastic surgeon. I understand that you're considering undergoing breast enlargement surgery, and it's a very exciting choice to be made. But there are questions that come up, and in my Beverly Hills practice, I do consultations frequently, and I thought it might be helpful to you for me to talk about maybe roughly 10 minutes on choices and options and what your experience can be expected to be like. So let's get started. Most patients come in and they're really looking to enhance their figure, increase their fullness, and make their breasts look nicer. They want to look better in clothing and bathing suits also. And if possible, they want a soft, natural appearing and feeling result. So the first question comes up as to what size can I achieve? And it really depends so much on how much loose and distensible skin you have, depends on the shape of your breast. Each person's potential is different. But basically, once I examine my patients, I give them an estimate, not a precise estimate, but an estimate as to what I think we can achieve, depending upon what size implant will naturally fit into their breast at the time of surgery. So I keep their goals in mind, but if they want a more natural sloping result, they may need to be a little more conservative. If they want a rounder, fuller, but less natural looking breast, then we can be a little bit more aggressive. I've developed a technique that helps me to place a somewhat larger implant in with a natural appearance that we can offer our patients. But still, sometimes it's prudent to avoid being excessive, and yet you don't want to be too conservative either. So we discuss that with our patients. We examine them, see the shape of their breast and the amount of distensible skin, whether they've had pregnancies or not. That makes a bigger change more feasible. Patients also ask about the type of implant that they have available to use. Most of us stopped using saline implants, so they're still available. They're quite good for women, especially younger women, with good skin elasticity and thickness, good breast tissue thickness. But over the passage of time, or with the passage of time, as your breast tissue thins, assuming it does with age and pregnancies, the fact that you've placed a bag of water may become more obvious by feel and even by appearance. Saline implants can feel more rippled and have visible waviness even. And many patients do choose to come back years later to have them replaced with silicone implants due to the fact that they have a more natural feel and less tendency to develop rippling or visible waviness. But that's not the case in everyone, and there are patients of mine who've had saline implants for 20 to 25 years and are delighted with them. But silicone gel remains the gold standard. It gives you the best chance of achieving the most natural result. Silicone and saline implants don't last forever. You have to assume that they'll need to be changed in the future, but a good soft result with silicone really is the best. For a couple of years now, I've replaced the silicone gel implants that I'd used for decades with cohesive silicone gel implants. I personally prefer the use of round, smooth silicone implants. The cohesive means that if the implant's cut or if it breaks in time, it doesn't ooze out into your breast tissues. It maintains its shape. It may still need to be replaced, but you don't have to worry about silicone getting out into your breast tissue or the surrounding areas, as you did with the silicone gel implants that were over 20 years of age. What are the more popular incisions? Well, number one, I like to use the incision outside the nipple within the perimeter of the areola. It's called a periareolar incision that allows me good access to the breast, allows me more flexibility in terms of the size of the pocket that I can make, and the positioning of the implant is facilitated by that incision. I used to use incisions in the underarm and still do for patients who want a saline implant placed through that area because of its being off of the chest wall and not being very noticeable. I really refrain and resist using an incision under the breast or the inframammary incision simply because all too often that incision is noticeable and visible and it's permanent. It's very difficult to take it away, and it's obvious why it's there when somebody sees it. The gummy bear implants that some doctors are using that are shaped, teardrop-shaped implants, require a textured surface and require a very big incision under the breast, often about 2 inches in size. And I discourage patients away from doing that because I've seen too many where the scar is too noticeable and they regret ever having it. During the surgery, as I said, we put in test implants, sizers, to see what gives a good balance of size increase and natural shaping according to the desires of our patient. And then I choose the actual permanent sized implant, size of the permanent implant, and make that selection. What's the healing course like? Well, most people are tender for the first 2 or 3 days, maybe quite tender, although many of our patients elect to have pain pump catheters inserted, tiny thread-like catheters that feed droplets of numbing medicine over the first 24 to 48 hours. I find that's quite effective in reducing the discomfort by about 70%, but most people are tender for the first week, mildly tender the second week, and then afterwards they're just recovering and being careful in their activities, but usually relatively pain-free. The pain pump catheters really help quite a bit and make for an easier recovery experience. I have patients start driving, limited driving, after about a week, and my patients don't return to exercise until about 3 weeks has passed. We can exercise the lower body at 3 weeks and start exercising your upper body and arms after about 6 weeks. We want to restrict the use of the arms for any exertion so that your healing has the best chance of occurring free of any complications. What are the risks of the surgery? Well, number one, the implants don't last forever. They probably will need to be replaced. In my experience, that's not usually before 20 to 25 years have passed if healing has been satisfactory in all other ways. But capsule contracture or hardening can occur, and that's when the membrane surrounding the implant is stimulated to contract, making the implant feel less soft and possibly displacing it or giving it the shape of a sphere rather than a teardrop. Sometimes that occurs to a mild degree and is not bothersome, but on other occasions it's more significant and can cause symptoms and require that the surgery be redone. The implants don't last forever, as I mentioned. There's a risk of numbness, but that's usually temporary. And in most of my patients, the sensation to their breast and nipple returns after anywhere from 6 weeks to 6 months. It really depends upon how your nerve responds to being stretched by the new size that you've achieved. Infection is extremely rare. Bleeding can occur. That's why we restrict blood thinners and physical activities for the first 6 weeks, but it's quite rare and usually easily avoided. I have my patients massage their breasts. I have my patients avoid a lot of physical exertion early on to give them the best chance of a natural and soft result. I think that summarizes it pretty well, and I would recommend to you that you visit my website at perlmanmd.com, PERLMANMD.com, for more information and to see many before and after examples and see the photographs. You can also call us at 310-854-0031 if you'd like to arrange for a consultation or have more of your questions answered by my staff. Thank you so much for your time. I wish you good luck. I'd love to see you at some point, and would love to answer any of the questions that you have and discuss the options with you. Please have a good day.